Dr. Naomi Namsi Shaban is a seasoned Kenyan politician, humanitarian, medical doctor, and long-serving legislator known for her influential role in national policy, women's empowerment, health advocacy, and community development. Over a political career spanning more than 2 decades, she has served in parliament, held multiple cabinet positions, and earned a reputation as one of Kenya's most respected female leaders. Her leadership style is defined by calm diplomacy, strategic influence, and commitment to grassroots development. Naomi Shaban was born in Taita-Taveta County, located in Kenya's coastal region. She hails from a family rooted in public service and community leadership, values that shaped her early ambitions. Growing up in a historically marginalized county, Shaban witnessed firsthand the challenges of poverty, poor infrastructure, and limited access to healthcare. These early experiences inspired both her academic pursuits and her eventual political journey. Shaban attended local primary and secondary schools before moving to Nairobi to pursue higher education. She enrolled at the University of Nairobi, where she studied medicine. After completing her medical degree, she specialized in obstetrics and gynecology, driven by a desire to improve maternal and reproductive health outcomes in underserved communities. Her medical training positioned her as a respected professional long before her entry into politics. Before stepping into public office, Dr. Shaban worked as a practicing medical doctor, focusing particularly on women and children's health. Her medical career exposed her to the realities of Kenya's healthcare system, including resource gaps, inadequate facilities, and the impact of socio-economic inequality on public health. She became an advocate for better healthcare funding, improved service delivery, and stronger reproductive health programs. Her community engagements, which often included free medical camps and outreach work in Taita-Taveta and beyond, strengthened her credibility among grassroots communities. These humanitarian efforts laid the foundation for her political entry, as residents recognized her as a leader capable of driving change. Dr. Naomi Shaban entered electoral politics in 2002, running for Member of Parliament for Taveta constituency. She successfully won the seat on a NAC, National Rainbow Coalition, ticket, becoming one of only a handful of women elected to parliament in that cycle. Her victory marked the beginning of a long and impactful political career. Once in parliament, Shaban became known for her articulate contributions, policy-driven approach, and advocacy on national issues, especially health, women's rights, devolution, and community welfare. Her early legislative work quickly earned her visibility, leading to appointments in powerful government positions. She was re-elected multiple times, serving continuously as MP for Taveta in 2002, 2007, 2013, and 2017. Throughout her tenure, she worked to bring development to her constituency, focusing on infrastructure, water access, education, and youth empowerment. Dr. Shaban has held several key government positions under different administrations. Her experience includes: appointed in 2003 and later again in 2008, she was tasked with overseeing disaster response, humanitarian aid, famine relief, and national emergency coordination. This role placed her at the center of major government responses, including droughts, floods, and post-election recovery initiatives. Dr. Shaban later served as Minister for Gender, where she championed policies supporting women's political representation, protection of children's rights, empowerment of persons with disabilities, social welfare reforms, community-based economic programs. Her leadership contributed to major gender and social policy frameworks, including efforts toward the implementation of the 2/3 gender rule. Beyond cabinet roles, she has also served as a parliamentary committee chair and influential member of committees focusing on health, labor, and budgetary oversight. Dr. Naomi Shaban is widely regarded as a pragmatic, moderate, and consensus-driven leader. She avoids divisive politics and is respected across party lines for her diplomatic approach. While she has aligned with different political coalitions over time, her focus has remained on development rather than political theatrics. Key pillars of her leadership include women's empowerment and representation, social welfare and community upliftment, healthcare reform and reproductive rights, good governance and accountability. She has also been a vocal advocate for peaceful elections, political tolerance, and national unity. Over the years, Shaban's contributions have been felt on both national and local levels. Strengthened gender and child protection laws, expanded humanitarian response systems, championed public health programs, supported national social safety nets, improved road networks and water distribution, boosted agricultural support for farmers, expanded access to healthcare facilities, introduced youth and women empowerment programs. Her work has shaped development policy and expanded opportunities for marginalized communities. Even beyond her years in Parliament, Dr. Shaban continues to be active in public service, mentorship, and policy advocacy. She remains a prominent figure in national discourse, particularly on women's leadership and governance. As one of Kenya's longest-serving female politicians, her legacy stands as a model of professionalism, integrity, and transformative leadership. Her story continues to inspire women aspiring to leadership positions in Kenya and across Africa. Dr. Shaban is known to be private about her personal life, preferring to be defined by service rather than publicity. Outside politics, she continues to practice as a doctor, mentor young leaders, and participate in humanitarian initiatives. Thanks for watching and subscribe for more.